Junita Jackson once said, "Your dreams may seem impossible to someone with insomnia." Welcome to the Fact Check channel. If you haven't subscribed, please do. Insomnia is a common sleep disorder. With insomnia, you may have trouble falling asleep, staying asleep, or getting good quality sleep. This happens even if you have the time and the right environment to sleep well. Insomnia can get in the way of your daily activities and may make you feel sleepy during the day. How sleep needs and habits vary and what that means for you. Sleep habits and needs can be very different from person to person. Because of these variations, experts consider a wide range of sleep characteristics normal. Some examples of this include early birds/early risers. Some people naturally prefer to go to bed and wake up early. Night owls/late risers. Some people prefer to go to bed and wake up late. Short sleepers. Some people naturally need less sleep than others. Research indicates that there may even be a genetic reason for that. Learned sleep differences. Some people develop sleep habits for specific reasons, such as their profession. Example, military personnel with combat experience often learn to be light sleepers because of the demands and dangers of their profession. On the opposite end of that spectrum, some people learn to be very heavy sleepers so they can still sleep despite surrounding noises. Natural changes in sleep needs. Your need for sleep changes throughout your life. Infants need significantly more sleep, between 14 and 17 hours per day, while adults, ages 18 and up, need about 7 to 9 hours per day. Types of insomnia. There are two main ways that experts use to put insomnia into categories. Time. Experts classify insomnia as acute, short-term, or chronic, long-term. The chronic form is known as insomnia disorder. Cause. Primary insomnia means it happens on its own. Secondary insomnia means it's a symptom of another condition or circumstance. Symptoms and causes. What are the symptoms of insomnia? Insomnia has several potential symptoms, which fall into a few categories. When you have trouble sleeping. Daytime effects. Chronic insomnia characteristics. When you have trouble sleeping. When you have trouble sleeping is an important symptom of insomnia. There are three main ways this happens, and people commonly shift between them over time. Initial, sleep onset, insomnia. This means you have trouble falling asleep. Middle, maintenance, insomnia. This form makes you wake up in the middle of the night but you fall back asleep. It's the most common form, affecting almost 2/3 of people with insomnia. Late, early waking, insomnia. This form means you wake up too early in the morning and don't fall back asleep. Daytime effects. Because you need sleep to be your best, disruptions like insomnia commonly cause symptoms that affect you while you're awake. These include feeling tired, unwell, or sleepy. Delayed responses, such as reacting too slowly when you're driving. Trouble remembering things. Slowed thought processes, confusion or trouble concentrating. Mood disruptions, especially anxiety, depression and irritability. Other disruptions in your work, social activities, hobbies or other routine activities. Chronic insomnia characteristics. The characteristics of insomnia symptoms are also important. If your symptoms have certain characteristics, you may have chronic insomnia. The characteristics include circumstances. A chronic insomnia diagnosis requires insomnia without circumstances that would interfere with your ability to sleep, such as changes in work schedule, life events, etc. Diagnosing insomnia requires having sleep difficulties despite having time and the right environment to do so. Frequency. Chronic insomnia requires you to have insomnia frequently, at least 3 times per week. Duration. Chronic insomnia lasts for at least 3 months. Explanation. The insomnia isn't happening because of substances or medications, including both medical and non-medical drugs, or other sleep disorders. Other medical or mental health conditions also can't fully explain why you're not sleeping. What causes the condition? Experts don't fully know why insomnia happens, but the current understanding is that this condition can involve many factors. Some of these factors could be causes or they could simply contribute to it. More research is necessary to understand exactly how and why insomnia happens. The factors that could cause or contribute include, but aren't limited to, the following. Family history, genetic sleep traits and conditions, including insomnia, seem to run in families. Brain activity differences. People with insomnia may have more active brains or brain chemistry differences that affect their ability to sleep. Medical conditions. Your physical health can affect your ability to sleep. This includes temporary illnesses like minor infections or injuries, or chronic conditions like acid reflux or Parkinson's disease. Conditions that affect your circadian rhythm, your body's natural sleep-wake clock, are also factors. Mental health conditions. About half the people with chronic insomnia also have at least one other mental health condition, like anxiety or depression. Life circumstances. Stressful or difficult life circumstances may not necessarily cause insomnia, but it's very common for them to contribute to it. Life changes. Brief or temporary changes are often factors, including jet lag, sleeping in an unfamiliar place or adjusting to a new work schedule, especially shift work. Long-term changes, like moving to a new home, can also affect sleep. Your habits and routine. Your sleep habits, also known as sleep hygiene, can contribute to insomnia. That includes whether or not you take naps, when you go to sleep, if and when you consume caffeine, and other habits. What are the risk factors for insomnia? Insomnia is also more likely to happen in people with the following characteristics or circumstances. Light sleepers. People who use alcohol. People who don't feel safe in their homes, such as situations involving repeated violence or abuse. People with fear or anxiety about sleep, such as those with disruptive sleep issues like nocturnal panic attacks or nightmare disorder. What are the complications of this condition? When insomnia is severe or lasts a long time, it causes sleep deprivation. A major concern with sleep deprivation is daytime sleepiness, which can be dangerous if you're driving or doing other tasks that require you to be alert and attentive. Sleep deprivation can also increase the risk of certain conditions. Depression, anxiety, high blood pressure, hypertension, heart attack, stroke, obstructive sleep apnea, type 2 diabetes, obesity, conditions that involve psychosis. Diagnosis and tests. How is insomnia diagnosed? A healthcare provider can diagnose insomnia using a combination of methods, especially by asking you questions about your health history, personal circumstances, sleep habits, symptoms, and more. They may also recommend certain tests to rule out other conditions that could cause or contribute to insomnia. What tests will be done to diagnose insomnia? There aren't any tests that can diagnose insomnia directly. Instead, tests help rule out other conditions with similar symptoms to insomnia. The most likely tests include sleep apnea testing involving an overnight sleep study in a sleep lab, polysomnography, or an at-home sleep apnea screening device. Actigraphy. Multiple sleep latency test, MSLT. Other tests are also possible depending on your symptoms and other factors. Your healthcare provider is the best person to tell you what tests they recommend. Management and treatment. How is insomnia treated, and is there a cure? There are many ways to treat insomnia, ranging from simple changes in your lifestyle and habits to various medications. The main approaches to treating insomnia are developing and practicing good sleep habits, also known as sleep hygiene. Medications that help you fall or stay asleep, especially ones that aren't habit-forming or that might otherwise affect your sleep. Mental health care. Medications that help you fall or stay asleep. Many different types of medications can help you fall or stay asleep. Many of these are sedative or hypnotic drugs, both prescription and non-prescription, as well as mental health medications, and certain herbs and supplements. Sedative drugs. these get their name from a Latin word that means, to settle. They reduce nervous system activity. Hypnotic drugs, these get their name from Hypnos, the Greek god of sleep. These make you sleepy. In general, your healthcare provider is the best person to tell you about the possible treatments and which they recommend for you. They're also the best source of information about the possible side effects or complications with treatments. The following information contains examples of medications, but it isn't a list of every treatment available. Remember that medications that treat insomnia may not help everyone. Some medications can interact with others, and your age and physical health play a role, too. It's also important to keep in mind that while medications can help you sleep, some may also negatively affect your sleep cycle. Sleep quality, not just quantity, is important. That means you should use medications, even over-the-counter ones, cautiously. Prescription drugs for insomnia. Several prescription drug types can treat insomnia. Depending on your location, some medications might have legal restrictions because of how they work or their effects. Types of insomnia. Experts describe insomnia in a few different ways, depending on its specific characteristics. 1. Acute insomnia refers to short-term sleeping difficulties that generally last no more than a few weeks. 2. Chronic insomnia refers to insomnia that affects your sleep 4 or more days each week on a regular basis, typically for a period of 3 months or longer. 3. Onset insomnia describes difficulty falling asleep. Trouble getting to sleep might happen as a result of caffeine use, mental health symptoms, or other common insomnia triggers, but it can also develop with other sleep disorders. 4. Maintenance insomnia refers to trouble remaining asleep once you get to sleep, or consistently waking up too early. This type of insomnia might relate to underlying health and mental health symptoms, but lying awake and worrying you won't get enough sleep can make it worse. 5. Behavioral insomnia of childhood involves consistent trouble falling asleep, refusing to go to bed, or both. Children with this condition often benefit from learning self-soothing strategies and following a regular sleep routine. Mental health care. Because your mental health can greatly affect your ability to sleep, mental health care is one of the most effective ways to improve your sleep, either directly or indirectly. A healthcare provider is the best person to tell you more about the possible mental health options and provide you with resources on how to get this kind of care. What can I expect if I have insomnia, and what's the outlook for this condition? Insomnia usually isn't a major concern. Most people who experience insomnia may feel tired or not quite their best the next day, but that feeling often gets better once you do get enough quality sleep. Chronic insomnia is disruptive. While it usually isn't dangerous, it can still negatively affect your life in many ways. If you notice you're having symptoms of sleep deprivation, it's a good idea to talk to a healthcare provider. They can look for possible causes for why you're not sleeping. They can also offer guidance and treatment that can help you sleep better. How long does insomnia last? Short-term insomnia is insomnia that you have for under 3 months. Chronic insomnia lasts more than 3 months. The causes of insomnia can vary widely, meaning how long you have insomnia can also change and shift over time. Your healthcare provider can tell you more about your insomnia and what you can do to limit how it affects you. How do you live with insomnia, to ensure you are taking care of yourself? Some of the most important things you can do to help your insomnia, and your sleep overall, revolve around sleep hygiene. These include, but aren't limited to: 1. Set and follow a sleep schedule. For most people, the best thing you can do for your body and sleep needs is to have a routine. Have a bedtime and keep to it as closely as possible, including on weekends, holidays, vacations, etc. Try not to rely on napping, and avoid naps in the late afternoon or early evening, as these can affect your sleep cycle. 2. Give yourself time to wind down. Put aside the concerns of the day before bedtime as best you can. Build in a buffer time between when you finish for the day and when you go to bed. That can help you get in the right frame of mind for sleep. If you can't fall asleep, Try to do something relaxing or calming rather than remaining awake in bed. 3. Get comfortable. Feeling comfortable is very important if you want to get quality sleep. Set your sleeping environment accordingly, including lighting, sounds and temperature. Some people prefer sleeping with a sound generator that plays a specific part of the sound spectrum, and you may want to try this, too. 4. Put that device down. Electronic devices typically use types of light that trick your brain into thinking it's not nighttime. That can disrupt the release of chemicals that tell your brain and body that it's time to sleep. 5. Mind what you eat or drink. Eating or drinking too much and/or too late in the evening can affect your ability to sleep. Eating or drinking certain things can also affect your sleep, especially nicotine products or things that contain caffeine or alcohol. 6. Stay active. Physical activity, even just walking, can help you get better quality sleep. 7. If you consistently have trouble sleeping, talk to your healthcare provider. Your primary care provider is a good resource to help you understand why you aren't sleeping and help you work on improving how you sleep. They can also help detect any health issues that might affect your ability to sleep. Common dangers of insomnia. 1. Fatigue. This is different from just feeling tired or like you don't have much energy. Fatigue is when you're so exhausted that it affects your work or home life and it's hard to even get through the day. It's one of the more common effects of chronic insomnia. It sometimes comes with a headache, dizziness, or sore or weak muscles. 2. Mood issues. A night or two of poor sleep can leave you grumpy and cranky. But longer stretches of sleep loss can cause more extreme emotions and make you more likely to feel angry or sad. Over time, chronic insomnia can lead to a mood disorder, like depression or anxiety. One large study found that those with insomnia were 5 times more likely to get depression than those who didn't have trouble sleeping. 3. Stress. Adults who sleep less than 8 hours a night are more likely to show signs of stress, like feeling overwhelmed or losing patience easily, than those who sleep longer, according to the American Psychological Association. They're also more likely to say their stress levels have risen in the past year. 4. Brain performance. That brain fog you notice if you don't sleep well for a night or two can get more serious over time. Sleep disorders like chronic insomnia can make it harder to remember things, concentrate, and make good decisions. Research has shown that getting only 5 hours of sleep a night can lead to poor judgment and more risky behavior in just a week's time. 5. Weight gain. Regularly sleeping less than 7 hours a night may make you more likely to gain weight. Scientists think this may be because sleep loss affects the hormones that control your feelings of hunger and fullness. Long-term lack of sleep could put you at a higher risk for obesity and the health problems linked to it, like diabetes, high blood pressure, and heart disease. 6. Less interest in sex. Chronic insomnia can affect hormones that control your sex drive, like testosterone. A man's body makes testosterone while he sleeps. Sleep loss can mean he'll make less of it. Research has found that losing sleep during the second half of the night seriously reduces testosterone levels in the morning. 7. Weaker immune system. While you sleep, your body releases proteins that help protect you against illness and inflammation. Chronic insomnia can affect that process. It also may reduce the antibodies and cells that help your body fight infection. Studies show that people who don't get enough good sleep are more likely to get sick if they're around someone who has a virus like a cold or the flu. 8. Diabetes. Losing sleep on a regular basis can affect the way your body processes blood sugar. This raises your risk for diabetes. In one study, adults who slept 5 hours a night or less were 2.5 times more likely to get diabetes than those who slept 7 to 8 hours. 9. Heart disease. Chronic insomnia can also be a problem for your heart. In one study, just one night of very little sleep led to higher blood pressure in healthy adult men. If that happens often over time, high blood pressure could damage your arteries. And it could make your heart work too hard to pump blood to your body. That raises your chances of a heart attack or heart failure. 10. Higher risk of accidents. Your odds of having some type of accident go up when you have long-term insomnia. That's mostly because of the fatigue and concentration problems that sleep loss can cause. In one study of more than 900 truck drivers, those with insomnia were almost twice as likely to have an accident than others. In conclusion, insomnia is a common problem. It can result from a range of issues, which may involve physical or mental health. In some cases, they are environmental or relate to lifestyle factors, such as shift work and caffeine or alcohol use. A lack of sleep can lead to a variety of problems, ranging from mild tiredness to chronic illness. Anyone who experiences ongoing trouble sleeping and feels that it is affecting their daily life should see a doctor, who can help identify the cause and recommend a solution.